Okay, give everyone a minute to log in here, of course, with us. I'm already seeing a lot of new names, of course. Awesome. Great. Okay, so we're just going to, of course, begin promptly. We do have a full hour ahead of us, of course. So for everyone kind of just joining us tonight, my name is Mike. I'm one of the account managers at Empire Medical Training. Like I was saying, I was seeing a lot of new people joining us in tonight. So of course, welcome if you haven't joined us before. But tonight I'm facilitating one of the webinars with our great vendor partners, Aerolace. I'm going to be introducing Katie in the next moment or so, of course. So one thing I do want to let everyone know, we have a great time, meaning that, you can put your questions at the bottom of the chat. We have a question and answer for the last 10 to 15 minutes or so. So it's a great opportunity to ask some of your questions you may have to Katie. She's a very skilled in the field. She's been doing this for a while now, of course. So she's going to take it away for us tonight. So of course, anything you have, there's a Q&A button at the bottom of the screen. You could just go ahead and ask your questions away there. We'll take the last like 20 or 30 minutes or so to answer them. I'm also going to provide you my general contact information if you had any questions for myself, maybe some of the membership questions you may have for some of the members that are with us tonight, and any other kinds of questions that you could always direct it to myself. Katie, of course, will make sure to help you out. But tonight we're going to be discussing a wide range of topics, of course. I would love to introduce Katie. She's very skilled in the field. She's an introduction for us as well. So
you were breaking up a little bit there. Okay.
Hi, sorry, I'm kind of lagging a little bit.
That's okay.
Perfect.
Hello, everybody.
Thank you, Katie.
My name's Katie. Thank you for having me tonight and coming on to the webinar. This evening, we're going to be speaking about epidermal and dermal renewal and how together we can get, complete rejuvenation of the skin and how they work and what epidermal renewal is, what dermal renewal is, and how they work together and why both are so important and not just working on one without the other, which a lot of treatments do. This is just about me. Real quick, I will talk a little bit about me. I've been in aesthetics for almost 15 years now. I have had experience treating clients for many years. Then I went on to teaching and certifying students that are getting into the industry. I am currently a clinical trainer for Aerolace Medical Laser, and I am also a consultant for medical different spas, and helping different locations get on their feet, purchase devices, and purchase skincare lines, chemical peel lines, whatever it is that they are needing for their practice. So I do a lot of different things, but I have a lot of experience in the industry on all levels. So let's talk a little bit about skin tightening, and we're going to be talking about skin rejuvenation also, and the difference between skin tightening and skin rejuvenation. So when we talk about skin tightening, we're really talking about the actual tightening of the skin and the reduction of the appearance of our wrinkles. So that is what we're trying to get when we look into skin tightening. When we talk about rejuvenation, we're talking about everything. So yes, we're still talking about wrinkles, but we're also talking about hyperpigmentation, scarring, large pores, everything that we don't like about our skin. So tightening and rejuvenation go very well together, yes, but they are a little bit different with what, the difference between the two is more that the rejuvenation really is about the overall clearing of the skin, where the tightening is mostly about our, the wrinkling in the skin. So when we talk about skin tightening, we need to work into the dermal layers of our skin by heating the dermal layers, causing that bulk heating, which causes collagen reproduction. And that's what we're always looking to do, is to get our collagen producing more like it did when we were young. So a good way to think about it is, I always give this example to patients because sometimes it's just a little bit too scientific, to get into with them. So I'll talk about, if you were outside and you fell and you cut your arm, you would get a cut and then the cut would heal and you could be left with some type of scarring. Well, that's because that is not a controlled injury. It was accidental that you fell. So when you do the injury that we're going to do to cause collagen reproduction, it's a controlled injury going into the skin. We're controlling it, but the body's response doesn't really understand controlled, non-controlled, and collagen goes to the area to heal, and that's how we get that collagen started. So with an accidental injury, we could be left with a scar, of some sort. With a controlled injury, at the end of the procedure, you're not going to be left with anything to scarring. You're just going to get that collagen production there. So it's just how our body responds to an injury. So the way that we can do that dermal heating with a laser, we are going into the skin, we're heating up by the laser energy being attracted to the water in the skin. Okay, so it's the ability for how the water's picked up by the laser, how that absorption happens. And it's relative to the output of the power from the device. And it's also relative to your depth of penetration, how deep you're actually going into the skin. And also how well that person that you're treating accepts that absorption. So, when you're treating clients, I always really try to talk about this. Everybody you treat is going to be completely different. So you're not going to get the same person on your table and treat them and get the same result all the time. Everybody's different. So you could treat one person with the same procedure that you treat another, and one person could have this phenomenal, outcome, and the other person could have, an okay outcome, but maybe not quite as, great as this person. And it all has to do with the, everybody, how they respond to a treatment, what they're doing at home, how their lifestyle is, all those factors will play into our skincare. So always keep that in mind. It's very hard to give people an expectation that you are definite of. You can give them realistic expectations, but it's hard to say, this is absolutely going to do this for you, because we don't always know how each individual person is going to respond. So when we talk about the concerns that we have in our skin, the concerns in the epidermis, the concerns in the dermis. Okay, so in the epidermis, where the concerns that we're mostly talking about are pigment, fine lines, tone, texture, and scars, and enlarged pores. Okay, they are in our epidermal skin layers. Okay, so when we are working on that, we're mostly talking about exfoliation and of some kind. Okay, so an ablative laser is going to take off layers of the epidermis and cause those conditions to look better visually. At the same time, it's really important that we're also affecting the dermis, so we can affect other conditions. So when we're treating hair removal, for example, we are going into the dermis because we need to get into that follicle and destroy that bulb so that we can get that hair, the bulb destroyed so that hair stops growing. Vessels and redness, there's no blood in the epidermis. So all that is in the dermis. Skin rejuvenation and tightening, where we're trying to get that collagen reproduction. Acne and pigment. Acne, we're trying to slow down that sebum production. And pigment is, you can see, both epidermal and dermal. Something really that I like to talk about with pigment, and why I feel like people get really confused when they get, let's say, for example, an IPL treatment. So when someone gets an IPL treatment, they do the treatment, the pigment comes to the surface, it crackles and dries out and comes off of the skin. And it looks amazing. But then that same client might come back in 6 months or maybe 2 months if they were in the sun or went on vacation with those same spots, and they came back. And that's because the IPL treatment really worked on the pigment in the epidermis. But pigment is not only in the epidermis, it's also deep into the dermis. So if we don't pull it from the dermis and get it where it is deep, it's going to continually come back. And, it's frustrating because then you want to have to do another treatment and another treatment. So if we work on that pigment, both epidermal and dermal, we're going to have a more long-term removal of that pigmentation. So we're getting it off, the top layers, so it looks better, but we also want to get it out of the dermal layers and then bring it off the top so that we remove the pigment altogether. So that is why it's really important to work with both layers of the skin together to get your best results. And we're going to talk about that tonight, how we can use these different devices to work together as one unit to give you your maximum benefit. So I kind of just went through this with the Epidermal Renewal, what we're talking about here. So when you remove those layers of the skin surface, they're quickly replaced and the body will grow new ones. And you're also eliminating any issues with those layers of the skin. And you can see here, these are some really nice pictures, how that by removing those epidermal layers, you get that refresh. This person here obviously had some sun damage, and you can see the wrinkles in the forehead. They're pretty, obvious, where when we took off a lot of that dead skin and damaged skin, we have this new fresh skin that looks so much more healthy and radiant. Same thing here. We have someone who has some pigmentation, possibly some melasma, it looks like. And just by refreshing the skin, she gets better tone, she gets better textured skin, and you can obviously see her pigmentation is looking so much better. Here's some acne scarring. So acne scarring is very twofold, especially because we have the scarring on the surface that we see. And then we also have this, unevenness in the skin. So when we take off some of those top layers, the skin kind of smooths out on the epidermis, but we're also trying to produce collagen to plump the scarring. So that's when we would be working in the dermis to get that collagen production. So it's kind of like very twofold to get your maximum benefit for scarring. And dermal rejuvenation is what we talked about, and the epidermis is left intact. So there's no damage that you see on the skin. Someone could have a treatment to do dermal rejuvenation and be fine right after. Nothing happens to the epidermis. We're going deep into the skin. We're working on removal of vessels to clear some dermal pigmentation, removing hair, reduce the sebum output for acne. So that's all working deep into the skin, into the dermal layers. And here you can see somebody who has some skin rejuvenation and some collagen production. Now, with collagen production, you can see it happens after, this is 4 treatments here. Collagen takes a little bit of time to get that collagen production flowing. So I always say, I use this little story, I guess you could call it, but like your collagen is awakened and it goes to the area you're trying to get it to go to, and then it kind of leaves after maybe the first treatment. Then the second treatment, it comes again and it leaves again. Then you do it the third treatment and it's kind of comes and it starts to build a new pattern, like you're trying to turn back what your skin used to do when you were younger. So you're teaching that collagen to come back to the area to rejuvenate your skin. So that's why it's so important that it's a lifestyle for these people. Like any of your clients, you don't want them to come to you one time and get this done or that done, and their skin looks good that day, maybe for a couple of weeks after, but it's always going to go back to where you started if we don't continue to treat. So getting these clients to come on long term is really what your objective is going to be, because when they're coming long term, you're going to get your best results. When they're constantly treating their skin and taking care of their skin at home, also, that they are going to have their best outcome, and it will be long term. It's a very common question I get. What can I do? What can I do to my skin? What treatment should I do? What would be best for me? Well, there are a lot of treatments that would be good for you. Not one treatment is the only treatment, but it's maintaining and doing finishing protocols and listening. They need to really follow instructions that you give, and that's when you're going to see your best results. So this is just some skin rejuvenation pictures. You can see that how the skin is just has so much more elasticity in it. It just looks healthier. The redness is removed, and it's just so much more plump, and it just looks so much better visually. Same thing here. You can just see that whole tone and texture of the skin looks better. This is just after 3 treatments, and the décolleté area is not an easy area to treat. The skin is really thin there, and it is a area where the sun really is on your body. If you're out in the sun, it's an area where you get a lot of sun. So it's a little difficult to treat, but this is such a great result just after 3 treatments with the Neo. And then here we have someone who has acne, possibly a little bit of scarring, but look how nice and clear the Neo was able to do for slowing down her sebum production and stopping that acne from continuing to come. So when you're treating a client with acne, I always say, people think, oh, I'm going to get this acne treatment and then my acne is going to disappear. When acne is already present, it has to go run its course. It has to clear from, it's already came out, but what we're really working on is not that active acne. We're trying to work on the acne that is ready to come. So we're trying to slow down that sebum production so that we, get that in control. So there's less acne, and eventually we can stop the acne. The Neo does an amazing job with acne. So when we talk about complete skin rejuvenation, we're talking about renewing the epidermis and remodeling the dermis. So when we work with both the Era Elite and the Neo Elite, that's when we're able to do both. Okay, so this is probably one of my all-time favorite treatments to do to a client. The results are phenomenal. You see such change because you're not just working on one, you're working on both, and you can combine them together. And when you do that in a protocol and you finish that protocol, the change in the client's skin is phenomenal. Really, it's like a complete change. Their texture, their tone, the clearing of their skin, it's just unbelievable. So the other thing that this is really great for, and to work on both the epidermis and dermis, is for a younger client. We tend to think that, well, not that we think, but a lot of times I feel like a lot of people come to me in desperation, like, what do I do now? Maybe they're 50, 45, 50, and they're starting to see this aging process really take over, and they want it fixed. Well, that's fine. And we can definitely do that by working in the epidermis and the dermis and doing all these things that I just spoke about. But a better way is if people start at a younger age and they do preventative treatments. So, you might think, well, why would someone in their late 20s, early 30s need an ablative laser treatment? Well, it's preventative. It's going to stop the skin from becoming damaged and from aging, because you're taking off that top layer and you are letting the skin constantly renew itself at such a young age. So just imagine if you're at 30 and you're constantly renewing that epidermis, and you do that throughout your 30s, when you turn 40, you're going to be so far ahead of the game than somebody who didn't do that. And at the same time, we still want to work on keeping that collagen production really moving and not losing that collagen production, because that's what happens. That's what starts to happen as we're in our 30s, 35 and getting older. That collagen slows down. So if we keep it stimulated, we're not going to have that drastic slowdown of the collagen production. So, I feel like this millennium, these younger clients, it is really a great opportunity for us to really broaden our, base of clients, because years ago, I feel like in this industry, the majority of people I would see in an office were somewhere between 40 and 65. I would say it was like really popular. Now that's not really the case. We see 20 somethings all the time getting Botox, getting fillers, doing laser treatments, doing all types of treatments that they, trying to stop aging from happening. So we're not just turning back time, we're kind of pausing it too at the same time. So when you think about wrinkles and like, why do we actually, like, why does this happen? There becomes a gap between our epidermis and our dermis. And if we can close that gap and fill in that gap, okay, we are helping to eliminate, the potential wrinkle aging process, okay? So let's talk a little bit about the ablation and what ablation is, how deep ablation can go. So we can talk about ablation. And when I say full ablation, it means complete destruction of the stratum corneum. So, or the epidermis, it's complete destruction. So when you think about fractional, it's partial destruction. So the fractional is putting all these little holes into the skin. When we do complete ablation, it's complete destruction. So when the Neo Elite is ablating the skin, it is going, I'm sorry, the Era Elite, I didn't mean to say Neo, excuse me. It's going about 12 to 16 microns into the skin. And our stratum corneum is between 10 and 20. Okay, so we can do, and that's with one pulse with our largest lens, we can get full ablation of the epidermis if we go deeper with maybe multiple passes in the skin or using a smaller spot size. So, okay, so this can only, when you work with the Neo and the Era together, you think, oh, it's two different treatments. I probably have to come on 2 different days, possibly, or how does this work? So the great part about this is we can use both devices and treat with both devices in the same day, in the same visit. So you would treat with the Neo first. I mean, the Neo first, I'm sorry, I'm getting my lasers confused. With the Neo Elite first, and you're going to work on that collagen and that dermal heating. And then we're going to ablate the skin with the Era and work on the epidermal layers of the skin and renew that, epidermis. So I'm going to talk a little bit more about a protocol, what a protocol for that would look like. But the combination of both it's a complete treatment. You're not missing anything. You can even specialize the treatment by using the Neo first. If someone was to have a lot of telangiectasia around their nose, or they have a lot of redness in the skin, it's going to work on that. So you're clearing, you're working on pigment with the Neo, and then you're going to go and ablate with the Era and really refresh all of that epidermal skin. Okay, I'm going to go to some of these slides here. These are mostly just pictures of how you can kind of see like the difference, how it changes and how the wrinkle actually appears to become less noticeable. All right, so why do we do a full ablation and non-ablation instead of partial ablation? So this is a good little picture here. This lady is all dotted, but she, why would you wouldn't want to put your skincare on like that and skip areas. So why not? Why would we want to treat that way? When we're doing a fractional, we are going into the dermis, but we're not ablating the skin. It's partial. So with full ablation, we're taking care of everything. Every single cell, every single, area of the face is being renewed. So these are some pictures of a combination treatment. So you can see here, this person not only has their skin been rejuvenated, but you can see such a difference after 2 treatments of the redness and the rosacea that he had and how much better it looks after 2 treatments of both together. So this is a 1 era treatment and 3 neo treatments together. So obviously this person is really pleased with the treatment. Her hyperpigmentation is now gone and her skin is glowing. She's 47 years old, so she's really, you know, excited. And I can attest to the excitement of clients from the treatment of these 2 devices together. People are just blown away. You know, they just absolutely feel amazing after. Their skin just looks so fabulous because not only, you know, did it do one thing, but it did so many things for them. So, you know, it just gave them a whole new appearance. So this is some protocol this is a protocol that we like to use. I personally myself use this protocol. It's really a great protocol. If you have both devices, you can, you know, name this treatment. You know, you can get a little creative in your med spa and, you know, call it something, you know, for your med spa, but you would work with both devices and you would start with treatment 1, doing the neo and era together. Then 4 weeks later, you would, I like to do both together again, but it really depends on the damage. Say it's someone who's in their 20s or 30s, you might not need to do another ablation that soon. So you could skip that ablation for the second treatment. But if it's an older client who really needs to get a lot of renewing of their epidermis, then you could do the era again. Then in treatment 3, 4 weeks after that, you're going to do neo and era together. Treatment 4, you're going to work with mostly just the neo. And this is when you can really focus on some issues that are hanging around still. You know, some pigmentation, some vessels, some things that really just didn't get completely resolved with the first 3 treatments. And then we have treatment 5 and 6, same thing. So you're basically doing 3 treatments of both and then continuing on with 3 more treatments of just the neo to really work on that collagen and to you know, finalize anything that didn't get addressed in the first 3 visits. And when we talk about pricing, it's a little difficult to talk about pricing exactly because, as we know, everybody is in a different demographic. Everybody has, you know, different ways that they can, you know, what they can get away with pricing. So approximately we're talking at about $3,500 to $5,000. So, you know, that's just approximate, you know, but it is a, you know, it's not a cheap treatment, but it's so effective that it's really worth it. Okay, so now we are, you know, if anybody has any questions or, you know, would like to ask any questions, you can ask them and I can answer. So you can, I think you can.
Thank you so much for that, Katie. It's very informative.
Mm-hmm.
Yeah, and I think we got a little disconnected there, so I'm glad we were able to rejoin. Some of the Wi-Fi is a little spotty. Now, yes, I know that we're going to just break into our questions. It looks like as of right now, we don't have any questions. But you know, it's a great time to, of course, just ask away. We have Katie here as well as Sean. He works directly with Aerolace, of course. If you have any questions on pricing or whatnot, the actual device, I believe we're going to provide our contact information. Perfect. So it looks like we do have a question that came through. Katie, I'll go ahead and ask you if you want. The first one that
I can't hear you.
Came through, it says is
Yeah, he's breaking up a little bit, but we have one caller is asking about cellulite treatments.
Okay, yeah, I see that question. Yeah. Okay, I can answer that for you. So as far as cellulite goes, cellulite is a very difficult thing to treat. We could treat the cellulite with the Neo Elite and, you know, possibly we will get a nice result, but cellulite is very hereditary and sometimes it's very, very challenging to treat. And then other times we could treat it and get amazing results. So it's extremely, you know, that client and how they respond to a treatment. is how we can really say, with cellulite, it's very difficult to treat.
Yeah, I don't think cellulite's been a perfected with device yet. You can definitely plump up some of the dimples that you have. But right now, I think some of the surgical options are relatively good at this point in time. People want non-invasive, but unfortunately, like I said, I think the expectations have to be set in order to actually really have a good or happy patient on that. So
Yes.
Next one coming up, we have Mirjam from Miami. She wanted to know if the machines can treat all skin types.
So this is good news. The Neo can treat all skin types 1 through 6 very safely with no concerns. Obviously, your settings must be appropriate, but it does such an amazing job on all skin types 1 through 6. As far as the Era goes, it also can treat all skin types, but there is some precautions that need to be taken when we're talking about 4, 5, and 6. So test spots, obviously we are not going to use a really small spot size. We would have to use the largest spot size, one pass, maybe lowering our energy, but it is definitely possible to ablate a darker skin type. It just has to be done with caution, and make sure that you're really diligent about getting the person's history with hyperpigmentation or hypopigmentation, just really knowing exactly what you're doing. And if you were to have the Era, if you purchased the Era, you would be, informed about all this information on how to treat for a darker skin type with the Era.
Mm-hmm. Yeah, so rejuvenation can be achieved with all skin types, by all skin types, including other medical treatments as well. Katie, what do you like to treat for African American skin? When you have someone that comes into you, we hear a lot about hyperpigmentation, acne, PFB, scarring, things like that. But what do you like to treat most?
So I love the Neo for skin type 6. It's so effective. And it does so many things. I can work on PFB, I can work on acne, I can work on wrinkles, hypopigmentation, so many things. And I see just aging. I see such amazing results, and it's really great to have a device that I can work on a skin type 6, because a lot of times with devices, it's not an option. The other thing I love to do with the darker skin type is chemical peels combined with the Neo. Does such a great job. There's a lot of chemical peels out there that are really great for a darker skin type. So the Neo gives you that freedom to treat everybody and to treat everybody all year round, because a lot of times when the summer months come, people are tan, so we're not able to use a lot of lasers on their skin. With the Neo, you can continue to treat tan skin without that concern of any damage or hyperpigmentation. So it's just amazing.
Yeah, we've done a lot of research, a lot of protocols for skin types 4, 5, and 6. It's one of the things that I find very gratifying, seeing done, just because it hasn't been available.
Yes.
But there needs to be a lot of education out there. And, for the people using the Neo Elite, they're really on the forefront of treating those skin types, which is a huge population. We talk about skin types 4, 5, and 6, but we also have a lot of mixed race and mixed skin types now too. It's very important to have the right devices in order to treat them.
Yes.
I have one guy asking about what's the difference between the Neo and the Era. Just to go over that real quick. Basically, the Neo is a 650 microsecond laser. It is a non-ablative device, meaning it does not ablate the skin, as Katie had gone over. So basically, it's going to work in a lot of the dermal layers in the skin structures, whether it be hemoglobin, melanin, or water. And it basically works in the skin to do 36 different applications. The Era is an erbium ablative laser, is a full field ablation, which means it takes off the entire layers of the skin where you're treating to have a nice rejuvenation. Works awesome on scars, acne scars, and especially on sun damage and things like that. Dr. Glazer, potential keloid tendencies. We are actually FDA cleared for keloids. It's definitely a contraindication But because the Neo is so gentle on the skin, I have not seen any sort of issues with that. Therese Wilson, thanks for joining us here. A novice, I'm sure you're going to be an expert in no time. Katie, sebaceous hyperplasia. It's something that we see with excess sebum production. Have you treated that?
Yes, I have treated it, and the Neo just really is an amazing device for that. It works really well. You just have, I use the like acne protocol usually for that,
Yeah, absolutely.
And it works amazing. Really, you're gonna love it.
Yep. So if you have since you have the Neo, look at the acne protocol. If you need any issue or if you want any pointers, or obviously Katie's here. We also have
Yes.
a clinical trainer.
And please feel free to reach out, ask any questions, more specific if you would like to.
All right, Tanya Ritchie, treating hair loss. That's something that we've kind of seen a little bit. For those of you that attend the ASLMS meeting, the Lasers in Surgery and Medicine, we've seen a little bit about that with combining ablation on the scalp, and as you said, with PRP, with laser treatments. It's an awesome combination. I've seen a little bit of research on the hair loss. Not great. I think that PRP is still a fantastic option for that. But including PRP with laser treatment, it's a killer combination. You want to talk about rejuvenation to another level.
It is 100% to another level. Yes.
Yeah, it's a very complementary treatment in general. So I'm not sure if you do that in your clinics, Katie. But
I do ERA with PRP, a lot. I love it. You can do it with anything that you're really ablating and opening up the skin. You can use the plasma, but it does such a great job. I use it as a mask after the ERA. So you do your ERA treatment and you literally just put the plasma onto the skin like a mask and have the client leave it on for 24 hours. And then they can just go about their regular recovery.
Cool. Russ Krauser, Katie, he's asking about how to maneuver the devices with the hose. I think that's all about how you set up
yes.
Set up the actual machine.
So, when it comes to lasers, period, any laser I've ever worked with, they're not really that user friendly. A lot of times you can, it's hard to operate. They're large. I love the Neo operation because it's not so cumbersome. As far as the hose goes, it's really not that short. It seems like that because most likely you're just not set up properly. You just have to really take that time prior to a treatment and get your device set up and maybe see where you're going to be treating. And don't be afraid to, in the middle of a treatment, say you move to the other side of your table or, you move somewhere and it feels like you're pulling on. Don't be afraid to just stop and wheel your device closer to where you're working at that time and go from there. That's really what I do. I move that cart around with me. I don't just leave it in one spot and treat the whole area. I move it to where it's going to work for me.
All right, back to Therese Wilson. When doing PFB, obviously hair loss in that area is an issue. And so that's kind of a more or less an agreement that you're going to make with the patient. Some men do want to keep their beard, yet some obviously PFB is called pseudofolliculitis barbae, is caused by hair growth and basically when the hair curls back into the skin. So they do, a lot of patients do want it gone, but if you wanted to keep that hair, Katie, do you have any recommendations for her?
So what question are we on? Can this device treat hair loss?
So, yeah, for lasering over the beard area for PFB, how do you not ablate the hair?
Okay, so because there's two questions, I'm not sure which one we're answering, but to use the device to work on an area where hair is growing, you're always going to have that risk of hair, loss. You can't control what follicles are in that anagen stage and what you're going to be able to destroy when you're treating. So you kind of have to, give the client that information and say, there's a possibility of loss here. There's not really anything you can do to stop that. But a lot of times men are okay with that because they shave and they really don't care. They may welcome it. And then other men, are not okay with that. They want to grow a full beard, and once you tell them that, they're just say, they're a no. So it really depends on the client, but it will affect hair growth in those areas.
Yep. Yeah, and sometimes you can go lower energy settings to not ablate the hair, but help with the PFB. But again, the PFB is going to come back time and time again if you have the hair there, if you do shave.
Yes.
So it's an ongoing thing, but again, it's really up to the patient as to how they want to proceed with that.
But like another option is if they're okay with that hair loss, that will eliminate that PFB.
Exactly.
If they can get the hair loss. So it's kind of like, what do you want? Do you want hair growth with this, going on, or do you want it cleared?
Mm-hmm. Back to Mirjam. This is a pretty loaded question here, but what type of skincare products and chemical peels do you recommend for melasma in skin type 5?
Well, so chemical peels, it's hard to really, for me to say to you what type of chemical peels, because we know different acids, some are more gentle than others, but it really is specific to what line you're using. So let's say mandelic peel, I love for a skin type 5, but that is in a specific line that I love it. So that peel in another line could be formulated different. The pH level could be different. So the peel could be more intense. So it really would matter what you were using more so than what type of acid you were using in the peel. So you just have to really be savvy with the line that you're using and educated on that specific line and know exactly what peels are okay for what skin type is really where you need to figure that out.
Yeah, we worked with a lot of skincare companies back with Neocutis, Zeo Skin Health, PCA.
I'm loving Elastin right now.
Elastin's really nice as well, but yeah, they're all complementary. And if you want to knock melasma out, again, you're going to have a epidermal layer and a dermal layer to it. So laser, we're working on those dermal layers, chemical peel that's going to exfoliate the skin.
Yeah, and any product is not going to fix melasma. It would just be like an added bonus to a treatment that you did for melasma. So it, just a product in itself, it's probably not going to take the client to where they want to be.
Yep. All right, Amy, can you address stretch marks? This is actually kind of a fun one, as far as I see. You can use both the Neo and the Era for them. Pigment in the stretch mark. We actually just had a patient. He was a 16-year-old who had massive weight loss and then also had a nice growth spurt. And so it was his back, on his lower back, he had some huge stretch marks, very, very red. So what we had him do was do the Neo first, and then we're going to address the white marks where there's no pigment with the Era later. I'm not sure if you do the same thing, Katie.
That's, the Neo will work really well on anything that has like, pink. It's pink, getting that color out. And then the Era works well on like smoothing out that skin, and getting it back to a texture similar to what it was prior to the stretch marks. Again, and I will say this over and over, that is an amazing treatment. It works really well on most people, but some people's stretch marks are more challenging than others. And it's just the way that it is. I always tell people when they come to me about stretch marks, I can definitely improve them, but I may be able to make them like really improved, but I may get minimal improvement. It really is how they respond to the treatment.
Okay. We have an attendee who wants your suggestions. So they see a lot of women in their 70s who want to do neck lifting, but do not want surgery. What would you do for that, Katie?
Okay, so it's probably one of the most difficult areas to treat. Someone in their 70s, I'm just really going to be honest, to get their neck to a place where they would actually be happy with anything, it would be very challenging without, surgery.
Yeah, it depends on the severity of the lax skin. Definitely help tighten it up. I think we had a neck picture earlier on with poikiloderma.
Yeah, but that person was a lot, was definitely not 70.
Well, it depends
Right.
on how aggressive the aging is.
Yeah. And how bad the damage is. If the skin is literally like hanging, that if it's that bad, you know, I don't know if you could get them to a place where they would be happy. Can you improve it 100%? You know, it will always improve, but it's not going to be the same as getting a surgery.
Mhm. And to that point, what about crepey necks for women in their 60s? We're going down 10 years.
We're going back. So the Era does a really nice job with that crepe, that texture. You know, it really can smooth that skin out really, really well. Also, the Neo will help, you know, with the collagen. So it would definitely help. You know, it really, again, it's basically the same answer. It depends on the severity of the damage, and it also depends on the client's expectations. If someone's looking for improvement and they just want it to look softer, better, then yes, 100%. If someone is looking for their neck to look like they're 25, you know, that's surgery.
Mhm. All right. What is different from the ZO Nd:YAG laser to Aerolase? It's a very common question we get. We actually have a different energy delivery system than other long pulse Nd:YAG lasers. Our basically pulse is a very sweet spot where you're delivering high amounts of energy in a very short amount of time. So the treatments are extremely effective and they're much gentler than others. It basically opens us up to a whole new levels of treatment, and that's why we have a lot of research on skin of color, skin types 4, 5, 6, because we open up a new way for them to actually be treated. Works differently in the skin ultimately. Jennifer Gilliam, we have, can you treat keloids or only FDA approved to do treatments on patients that are prone to keloids? So we do have an FDA clearance on keloids and scars. Again, you know, depending on how you address the skin, if people are keloidal, you know, there does need to be some caution there. But again, the FDA has granted us clearance for actually addressing those scars.
Hi, Jennifer.
And
Can't say hi back, but
it's all good. This is a fun one here. What's your best combo treatment for the décolleté?
so the Era does an amazing job on the décolleté. It really does such a great job. I like to combine the two treatments. Because that skin is so superficial and thin, the sun damage on the décolleté is very superficial. So the Era does an amazing job with getting that lighter and clearing that. You know, I loved using that for that.
Mhm. Let's see, apoptosis of fat. No, I mean, I see some lasers being used for fat reduction, and I'm not crazy about it. I still think that when you're looking at like an RF, that's doing okay these days. You know, cool sculpting is still there as one of the best apoptosis, but I think that when you're talking about actual rate reduction, you know, all of the protocols call for diet and exercise, with, you know, cool sculpting being, you know, still one of the standards, I think, at this point in time. There's a lot of devices out there doing body contouring these days. We hear a lot about it. It's pretty revolutionary, but I don't think anything's been perfected yet. I don't know what you've seen out there, Katie. Does Strella have a?
I don't really have a good answer for that one because it's a very tricky area, and you know, it's just hard to treat, like you said.
Yeah, it's something that, I mean, if I had a spot, it's something I would definitely supplement with, but it was not something I would lead with. I think you know, we see 90% of the procedures are done on the face. Face is always going to be the first thing you see on someone, regardless of what else they look like. So.
Yes, and that's 100%. You know, I think that is the first thing, you know, that this laser does such an amazing job on the face. Can it work on the rest of the body and other areas? Yes, it absolutely can, but it's definitely most efficient on the face.
All right, back to Dr. Glazer here. Can the Era or Neo be used for the treatment of scars, acne, or traumatic scars? And then what about combining that with PRP?
So you know, it can be used for scars, acne, traumatic scars, 100%. Combining it with PRP is just going to really give it an added bonus, but it absolutely can be used without PRP and still, get amazing results. PRP is really just one of those things that it just really kind of just like bumps up the result.
Yeah, yeah. We did a study about 4 years ago, looking at acne scars, traumatic scars, and how well they resolved versus how old the scars were. Basically, what we found, if you treat a scar within its formation within the first 14 days, amazing results. The further down the line you go, the harder it is to actually resolve what's actually there. So we looked at a year, 6 months, 3 months, 14 days, and the 14 days one was the best results that we've seen with the era.
Yeah, if you catch it, early, your chance of definitely better.
Yeah. Back to thanks for asking all these questions. This is fun.
It's amazing.
So, and I like the way that she has this. How about monster pores on the face?
So that means they're bad. So the Era does a really great job with pores. It's amazing. But the Neo is also a huge contributing factor to that because you're slowing down that sebum production. So what these clogged pores are all this overactive production of sebum. And then when our face has all this dead skin on top, it's almost like you're putting a lid on top of the pore. Like it has like a little lid on top, and that sebum production is happening so rapidly that it's just, the pore is just overcrowded and it's open. When we take the lid off the top and we slow down that production of oil, it's able to like get itself, back to where it was supposed to be, and it will close those pores really nicely.
Mm-hmm. All right, and then we have one question about upper eyelids and one about lower eyelids.
So the Era is safe to treat within inside of the orbital rim. So yes, you can work on upper eyelids and lower eyelids. I have done many treatments on people's upper and lower, almost straight like to the eyelash. The biggest problem with that part of like treating that is client comfort, and not even like that it hurts more. It's like a fear. Some people are just not able to really sit through it because, they get nervous. But if a client is able to sit through it, and you can also use shields on the eyes, so, we know that their eyes are completely safe, go for it because the results are phenomenal.
Yeah, we have a lot of ophthalmologists and a lot of facial plastic surgeons that do Era in combination with the blepharoplasty. And you can actually do even, if people don't want to have surgery, there are options for laser blepharoplasty. But yeah, it's a very nice treatment.
And with the when they do it in combination like that, the surgery, it doesn't really improve that texture. So, doing both, it just really like bumps it up with the texture of that skin that was, lifted or, cut.
All right, Mary Lawson. Did we touch on price? We did not touch on price, but we'd be happy to discuss that with you offline. And then Katie, I think this is actually a pretty good closing question. I think.
This is a great question.
If you were only going to purchase one of these two lasers that we've discussed tonight, which would be your introductory laser?
So 100%. This is such a good question. I might need like 50. No, I'm just kidding. But so it really, you want to look at your practice. Okay. So it's important to take a look at your practice and what are your needs. The majority of the time, I would say 9 times out of 10, a new practice or any practice would probably be better off starting out with the Neo because it has so much to offer in terms of treatment. There's so many things. I mean, I consult a lot of different med spas, and I love the Neo for us, like to start your practice with, because you can have hair removal, you can have rejuvenation, you can do vessels, you can do leg vessels, you can do so many things, and you can offer all this to your client with one device. It's kind of like a no-brainer. I see a lot of people go out and buy like multiple devices to do all the things that the Neo does. Then I would recommend after you, maybe make some of your money back and you get some, in a better spot, purchasing the Era to, add to that, the two together, there's nothing you can't do, really. Once you have both, there's not a treatment, that you, or a condition that you can't work on. The only time I would say to go for the Era first is if you have a practice that you don't really do much except injectables, and your clients aren't really into like skincare and doing like that type of a treatment, like chemical peels and microneedling. If they don't really want to get into all that and they just want to improve, if you had an Era, so ablation with injectables together is a really great combination. So if you were, a strictly injectable practice, I would say, maybe you would go with the Era first, but I would say the majority of the time I would recommend purchasing the Neo first, and ultimately purchasing them together, is the way to go. But, if that's not an option, I would say go with the Neo.
Excellent.
Not because it's better, just because it's, will give you more options to begin with.
Right. And I have to touch upon this last one. I grew up in a house of podiatrists. So how about fungal nails, otherwise known as onychomycosis? They've heard that from dermatologists that laser isn't ideal. Back in 2011, there was a huge movement within lasers in podiatry and using them. A lot of them were relatively low powered. Some really, really hurt. There weren't a lot of like large studies on that. However, that's one of the things that we've really seen a lot of non-core, a lot of podiatrists and even dermatologists are actually using the Neo for fungal nails. I have a client up in outside of Albany, New York, the wonderful Sandy Padilla and Michael Salzman. They're a medical spa, started off as a primary care office, and that's their number one indication. They do about $30,000 a month just on fungal nails alone. But it's an awesome thing, especially for those that don't want to take terbinafine or any other oral medications. And it's just it is a nice thing. But yeah, I'm not sure if it's a dermatologist that's been burned by another laser, wasn't happy with it. But yeah, we have a nice study on that shows some great efficacy. So.
And I mean, I'm gonna 100% disagree with someone saying laser isn't ideal for nail fungus, because I have cleared so much, so many people with the Neo. And, I don't like to admit this, but I actually had an issue from a nail salon. I had a fungus on my nail and it worked amazing. It's just a really great, it's such a great treatment for that, because you're not affecting your health by doing it. You're not taking anything orally, and the clearing is phenomenal.
Mm-hmm. Okay, so I think we actually came to the end of this. Thanks, Therese. Appreciate this. Appreciate your kind words. She says we need more.
Oh, that's very nice.
But Katie, thank you very much. I don't know if Michael jumped off here, but no, thank you, Empire Medical Training. For anyone that wants to get more information, information at aerolays.com. Aerolays.com is our website. Follow us on Instagram at Aerolays for some awesome results. A lot of practitioners on there. Very happy. But Katie, thanks for all of your expertise.
Thank you, everybody, for coming and listening this evening.
Absolutely. Thanks, Henry. Bye.
Bye.